Good day, friends of Buzzy. Still not a perfect day, but it's a good day. As you can see, I still am convinced that the best way to not get coronavirus in is to use a little nose clip, and I'm definitely fond of these little guys because you can bend them and get them to fit. You do still sound weird, and things probably still taste weird. Today, we're going to start by talking about healthcare equity and every paying care lives. From now on out, I'm going to focus on one either Black-owned or minority or inner-city healthcare equity program, and we will be giving them freebies. So if you have one that you'd like us to know about, please send it on. I'm going to talk about, we're at 6 months of coronavirus now, and so I want to talk about what we know, what we don't know, and one particular thing that the healthcare leaders I have been listening to and hearing are not talking about, and it's important. And so we're going to talk about that. I'll update you on the nasal irrigation study, and then I'll also talk about a new paper that came out about telehealth and physical therapy that prominently features FibroCool. So let's start at the top of the hour. I'm still very upset about the fact that racial equality somehow seems to be a political issue and not an economic issue. I'm particularly miffed that on LinkedIn, which is supposed to be about business, people are too afraid to even like posts. I mean, people, this is economic. This is not about politics. This is about racial inequity, increasing our healthcare costs, and decreasing the ability of human beings to contribute fully to the degree of their ability and effort because of unequal education and unequal opportunities. This is about a long-standing, unequally applied set of rules, of opportunities, of monetary issues, and this is also about where we're going as a country that's turned around in the last 20 years. So this is something that's about business, and it's about our future as a country, and so this should not be political. There are a lot of political and emotional and moral overtones, but I predict that within 2 or 3 days, everybody on LinkedIn is also going to be realizing that this is a corporate business no-brainer, and everybody will be supporting this. So get on the bandwagon now and like comments about how it makes a difference to have justice in your companies. So I would like to feature right now a company that is one of Startup Health's entrepreneurial ventures, and this is called Cityblock, and it was started by a doctor, Dr. Toyin Ajayi, A-J-A-Y-I. I can't pronounce it. I would like to learn. But what they're doing is, since the coronavirus hit, they have been going to people in Manhattan who can't get to the doctor. They've been doing telehealth. They've been physically helping and going out to support the community with medical access and healthcare. So we would like to give you 10 of our products. You can use our Buzzy products if you'd like. You can use the FibroCool products. Somebody from you guys get in touch with us, and we will send you whatever we can that is most useful to your health outreach. Now, second thing, let's talk about where we are with coronavirus. It has been 6 months, and we are pretty comfortable knowing who is most at risk for getting the disease. We know the risk factors, we know everything, how, I guess new things we've learned are that asthma and immunocompromise, and in one UK study, even cancer actually, are not as big risk factors as are things like heart disease, chronic obstructive pulmonary disease, kidney disease, and obesity, and there's one I'm missing. But those are underlying, diabetes. So the reason for that is really all about the ACE2 receptor. And now that we know this, there are a number of other fun things that we've learned about medications. So ACE2 inhibitors actually seem to decrease the severity of disease. So if you're on an ACE2 inhibitor, for God's sake, stay on it. But that's one thing that's good to know. Another interesting thing is that the immunologic suppressant drugs that change the way that the cytokines work, that change the way that the T cells work, These medications have been used as injectables, and we've known about them for a long time because Buzzy is something that makes it easier to take these injections. Turns out people who are taking these injections that make their immune system less excessive, those medications are also working well to decrease the severity of coronavirus. So there are randomized controlled trials in progress. Those are going to be a big part of how we treat coronavirus, and doing it early is definitely going to be a big issue. So the earlier the treatment we stop this big immune cascade, the fewer people die, the better they do. Now, something else about coronavirus that is not being, I believe, accurately reported compared to what the research is that people are saying there's not a big degree of seasonality to coronavirus. And that's just wrong. There are not only about 8 different studies that very specifically show that the warmer it gets and the more humid it gets, the less long coronavirus is on surfaces, the less easy it is to transmit, the fewer people get it. But there also is a lot of data that just shows from how spread has happened in this country that temperature matters. So we were all waiting around to see what would happen with the increase in coronavirus cases after Memorial Day. You saw all these people in the Ozarks and everybody jammed together, and it's like, woo, there are going to be cases all over the place. They're basically licking each other. Turns out the only places that have had really precipitous increases in cases are states that are cold. In the last 7 days, Alaska's infection rate has more than tripled, and Oregon, and Vermont, and New Hampshire, and Montana, and Washington State. Those are the states where disease cases have gone up. Cases like Georgia and Alabama and lots of other places that opened up early and had plenty of fraternizing, their cases haven't increased. So this is a really important part of how we're doing the tests. The research on what to do, because as many of you may know, I wanted to do a randomized prospective trial looking at nasal irrigation on impact of disease. So there are 12 different groups that are looking at some form of intranasal antimicrobials, neem oil, hydrogen peroxide, betadine, squirting, irrigating, spraying, you name it. We know that it enters through the nose, so that's a good place to try to decrease the viral load and the efforts of the virus to get in. Unfortunately, it takes, there's a truism in research that as soon as you start researching something, the number of cases you're looking at go down because it gets really hard to enroll. And as we have started to put this together to do our own randomized controlled trial, I wanted to focus specifically on the African American community because they've got a much heavier burden of coronavirus. This was even before the protests, although it was after George Floyd was murdered, obviously. But we couldn't get enough money to do the trial if we didn't have enough cases per day. And because in Georgia, our temperature is now well above 56 degrees every day, the number of cases has been flat. So looking at the temperature curve for the state of Georgia, we're not going to get back till days are in the 56 degree range as a low until mid-September. And this means that we're not going to hit more coronavirus cases until October. So I have asked our group in Augusta to put the trial on hold. And by then we'll see whether or not other groups have already answered the question, at least about viral load. And hopefully we'll have some more support for looking at decreasing severity in people who are positive. This is a critical part that we are missing the messaging on. Temperature matters. And unless we make that clear, people are going to feel like coronavirus is actually not a serious illness and it was overblown. What do I mean by this? Well, the concerns about protesters getting coronavirus from being close to each other are real. And certainly you can definitely still catch coronavirus from someone breathing, shouting, not wearing a mask. We do still need to be wearing masks, and we do still need to be distancing and aware of where we are. That said, it's very clear that when the temperature is hot, coronavirus transmission goes down. One study found that for every degree Fahrenheit above 56 degrees, the change in transmission went down by 14 to 16% per degree. When you're outside and protesting, or when you're outside and you're wearing a mask, there isn't going to be nearly as much spread when the weather is hot. It just isn't. And so this message is critical. We will have a second peak. The temperatures in Alaska and Montana and Vermont and New Hampshire, all of them were cold after Memorial Day, and their cases went up precipitously. So we need to realize and let people know that we do expect there to be less transmission this summer, because otherwise we're not going to get the contact tracing, the testing, and the incubation and isolation areas set up that we have to have by October. One other thing that happened this week that you may have missed is that Brett Giroir, who is a doctor who hired me at UT Southwestern, he was the testing czar. And this week they announced that he is going to be moving back to his normal duties at the Department of Health and Human Services, but there's no replacement. We don't have anybody right now in the White House who's working on a testing, isolation, and contact tracing program. So this is a concern. All right, so finally, a little bit about some good news for us. We do anticipate, this is bad news, we do anticipate that in the fall we're going to go back to decreased elective surgeries, and people will be at home and having pain and not their normal ways of dealing with it. The good news is that there is an article by Tiziano Maravino in Practical Pain Management, and he listed 4 different devices that their group has found that their patients are wanting to use at home. It's good because the question of whether patients would just sit and be despondent in pain or actually be active was an unknown. Now we know. Patients want to do things at home. And one of the things that Dr. Maravino's group has found patients like is the Vibracool. So this is an idea from someone that has had 7 different ACL surgeries. So instead of just having, this is the elbow unit, what they're doing is putting a flex on the other side so that both sides of the joint get the same therapy at the same time. So for example, if you've got a knee replacement that you're waiting on or that has happened, then having one unit on one side and one unit on the other so that they pass through the joint. This has been found by at least one guy who had 7 ACL repairs, that this was much more effective than his previous experiences, and that it was tremendously good for pain relief. So doubling up is a cool idea. And thank you very much, Dr. Maravino, for putting us in Practical Pain Management. All right, so to review and then our moment of Zen, we are very excited about Cityblock, a healthcare outreach in New York. We do very much believe that nasal transmission can be blocked by not breathing in through your nose, and suggest nasal swimming things. We're putting the nasal irrigation trial off, at least at our institution in Georgia, until we have more cases. There will be more cases when your local temperature drops to 56 degrees, and if you are stuck at home, Vibracool can be used as a single agent, or you can put it so it's on both sides. And now, your moment of Zen. Big thank you to Jennifer Tipping, who sent this link for hippos hanging out in the Cincinnati Aquarium. When I was in residency, we had 3 young children under the age of 5. No, it's not true. They told me she said 2. We had 2 young children, but they were boys, so that totally counts. And getting out of the house and doing something with them was a struggle. At the Cincinnati Zoo, next to Children's Healthcare Medical Center in Cincinnati, there was an aquarium that had manatees in it, and now the manatee area has hippos. So we will share with you this lovely, fantastic, calming, ongoing hippo cam. And there's one particular thing a couple minutes in of a baby and a mama hippo that reminds me of a much more peaceful and delightful version of the Jungle Cruise at Disney, except where you can see under the water, not just when their little ears come out and wiggle at you. Be kind to each other. We're learning things. like and support when somebody says something about how racial justice matters and Black Lives Matter, because duh. And if we all do that, it's going to be